Human Growth Curves. UGC NET Anthropology. Unit 4. Part 2. Welcome to AnthroNet Academy, a study aligned with the UGC NET Anthropology syllabus. Dear learners, please subscribe to my YouTube channel, AnthroNet Academy, to keep me motivated to create more content for you. Don't forget to like, share, and hit the subscribe button. And make sure to click the bell icon so you never miss an update. Growth Curves Overview. Growth curves are graphical representations of an individual's or tissue's growth over time. They can help assess if growth is occurring normally or if there's a deviation due to pathological or environmental causes. Distance, velocity, and acceleration curves. Distance growth curve. Definition: shows cumulative growth over time, e.g., height or weight versus age. Shape: smooth, upward sloping curve. Interpretation: used to track how much total growth has occurred. Example: a distance curve plotting height. From birth to 18 years. At birth, 50 centimeters. At 2 years, 85 centimeters. At 18 years, 175 centimeters. The curve shows total height at each age. Velocity growth curve. Definition: shows rate of growth at different ages, change per unit time, e.g., cm/year. Shape: peaks during infancy and puberty, dips during childhood. Interpretation: helps identify periods of rapid growth. Growth spurts or slowdowns. Example: a child grows 25 centimeters in the first year. Velocity equals 25 centimeters per year. At age 6 centimeters per year. At puberty, 14 years, 9 to 10 cm/year. After puberty, slows again. Definition: represents the change in velocity over time, i.e., how fast the growth rate is. Changing. Use: rarely used clinically but important in understanding growth kinetics. Interpretation: positive acceleration increasing. Growth velocity: negative acceleration slowing. Down. Example: if a child's height velocity increases from 5 centimeters per year at age 10 to 9 centimeters per year at 12, acceleration is positive. If it drops to 2 centimeters per year at 16, acceleration is negative. Scammon's growth curve. Scammon's curves, by Richard Scammon, 1930, show growth of different tissue types. From birth to adulthood. Tissue type. Growth pattern. Key features. Lymphoid. Rapid growth in early years, peaks 10, 12 years, then involution. Tonsils, adenoids. Neural. Fast early growth, 90% by 6 to 7 years. Brain, spinal cord. General. S-shaped, slow in childhood, spurt in puberty. Height, weight, muscle. Genital. Minimal until puberty, then sharp rise. Reproductive organs. Neural, rapid early growth, plateaus by 6 to 7 years. Lymphoid, overgrowth in childhood, involutes after puberty. General, S-shaped, infant plus pubertal spurts. Genital, minimal growth until puberty, then sharp rise. Clinical application. Brain development, important for early childhood stimulation. Genital development, delayed until puberty, useful in Tanner staging. Tanner growth curve. The Tanner growth curve refers to the standardized charts and models that depict patterns of physical growth, height, weight, and secondary sexual characteristics in relation to pubertal stages, called Tanner stages or sexual maturity ratings, SMRs. Tanner defined 5 stages, stage I to V, of sexual development, used to assess pubertal progress. Tanner stage, boys, genital/pubic hair, girls, breast/pubic hair. Stage I, prepubertal, prepubertal. Stage 2, testes enlarge, sparse hair, breast bud, sparse hair. Stage 3, penis growth, more hair, breast enlargement. Stage 4, penis width, coarse hair, areola separates, dense hair. Stage V, adult genitalia and hair, adult breast and hair. Growth velocity during puberty. Puberty triggers a rapid increase in growth velocity. Height per year. Boys typically enter puberty later than girls, but experience a greater total height gain. Peak height velocity, PHV, occurs. Around age 12 in girls, stage 2 to 3, age 14 in boys, stage 3 to 4, clinical importance assessment of pubertal delay or precocity. Helps identify whether a child is growing appropriately for their stage of sexual development, growth disorders. For example, a child with constitutional delay may have delayed Tanner stage, but normal adult height, monitoring hormonal treatment. Such as growth hormone therapy or puberty blockers. Catch up and catch down growth. These are adaptive changes in growth due to prior growth restriction or acceleration. Catch-up growth definition, a faster than normal growth rate to return to the original growth percentile after a period of slowed growth. Causes: illness, malnutrition, prematurity, endocrine disorders. When corrected, white heavy checkmark example. A preterm baby, born at 1.5 kilograms, gains weight rapidly and by 2 years, reaches normal weight for age. Clinical case studies. Case 1, catch-up growth history. A baby boy born at 32 weeks gestation, preterm, weighing 1.6 kilograms at 6 months of age. His weight is below the 5th percentile. However, by age 2, he is in the 25th percentile for both height and weight. Interpretation: this is a classic case of catch-up growth. The child had intrauterine and early postnatal growth restriction due to prematurity. After the cause was resolved, the child grew at a faster than normal rate to approach his genetically determined growth trajectory. Catch down growth definition, a slower growth rate to return to a genetically predetermined growth percentile after a period of accelerated growth. Causes: infants born large for gestational age due to maternal diabetes or overfeeding. White heavy checkmark example. A baby born at 4.5 kilograms, above 97th percentile, shows reduced weight gain after birth and normalizes to the 75th percentile by 1 year. Case 2, catch down growth history. A baby girl born at term weighing 4.4 kilograms, above 97th percentile, no maternal diabetes. At 6 months, her growth rate slows down, and by 2 years she's at the 50th percentile for weight and height. Interpretation: this is a case of catch-down growth. The baby was born large, likely due to intrauterine overnutrition or genetics. Over time, her growth adjusted to match her intrinsic growth potential. Thank you for watching. Stay connected.